Hello friends, welcome to Chanderpreet Homeo Edifications. Well friends, henceforth we shall be taking up discussions on very important homeopathic remedies, and I shall be taking up sessions like we'll be discussing very important tips pertaining to very important homeopathic remedies, and this will be from the therapeutics point of view. Now these discussions will be in addition to the information provided as per the Materia Medica. So these are going to help us in our clinical practice, in our general and our daily practice. These tips and this information about homeopathic remedies is certainly going to help us in our clinical practice. Today's remedy of discussion, we shall talk about COFFEA CRUDA and how it fares vis-a-vis very important other remedies pertaining to very important symptoms. Like we shall take up difference and comparison with chamomilla and similar symptoms like those of aconite as well. So let's see how COFFEA CRUDA fares from the therapeutic point of view. Let's discuss some very important points pertaining to COFFEA CRUDA. See, first thing is very important to note that COFFEA acts strongly on the nervous system, just like chamomilla. But here the very striking point of difference we can take up as in nervous affections, if the patient has not been addicted to coffee habit, right, mark my words, then COFFEA will be the drug of choice. But in case if he is a coffee drinker, chamomilla is the remedy. The COFFEA patient is a subject of great general exalted sensibility. If I read Heading's characteristic cards about COFFEA, all the senses more acute, the patient reads fine print easily, smell, taste and touch acute, particularly also an increased perception of slight passive motions. There is an unusual activity of mind and body, full of ideas, quick to response, and there is no sleep on this account. See, there are lively fancies, full of plans for the future. And that is a typical COFFEA CRUDA patient. Now these symptoms portray the nervous conditions calling for the remedy COFFEA CRUDA. It makes one think of chamomilla, but the mind of chamomilla is not there. On the other hand, it also makes us think of aconite, but the fear of death is not there. Heading used to recommend the use of aconite and COFFEA CRUDA in cases of painful inflammatory conditions, where there was the symptom of fever that's resembling that of aconite, and the nervous sensibility symptoms as those of COFFEA CRUDA. But we should always learn the art of individualization. COFFEA is especially adapted to mental shocks such as sudden surprises, especially the joyful surprises, excessive laughter and playing, disappointed love, and then strong smells, noises, etc. It is also adapted to variable moods, first crying, then laughing, then crying again. We are also wise with chamomilla and aconite as a pain remedy, right? The pains are insupportable, drive to despair, exasperation, tears, tossing about in great anguish. Now here again we would not give COFFEA if he is a habitual coffee drinker, rather we'll give chamomilla. Then the particular localities have to be understood where the pains occur mostly in the head, and they're one-sided and as if a nail was being driven into the head, right? Now ignatia headache is also similar but found in more hysterical subjects, so a choice of remedy has to be made here. COFFEA has a very peculiar toothache. The tooth is easy as long as cold water holds upon it, unlike the chamomilla toothache, which is caused by warm things into mouth and is not relieved by cold things in mouth. In case of dysmenorrhea with excessively painful colic, remember COFFEA. But if there are black clots and COFFEA does not relieve it, follow it with chamomilla. In short, we can say pains anywhere which seem to be intolerable with no other leading symptoms, COFFEA is to be remembered. The great overexcitability, which is a characteristic feature of this drug, causes great sleeplessness, and COFFEA has won the credit as a sleep remedy here. Also, cough and sleeplessness after measles, now this is a common recurrence, okay, are greatly relieved by COFFEA CRUDA. So I end my discussion here on COFFEA CRUDA with these very simple tips. Apart from the general discussion of materia medica, I hope you will find these tips quite useful in your clinical experience, in your clinical practices. We will be discussing some more such remedies with particular reference to the therapeutics point of view. Okay, so stay tuned to Chanderpreet Homeo Edifications for more such discussions. If you have anything in your mind, some suggestions, some particular requests, you can always mention in the comment section. You can mail me at chanderpreet@gmail.com. Till we meet in the next video, take care of your health. God bless.